Hi, I'm Dr. Adam Abs. Today I'm going to talk you through the respiratory examination in a remote consultation. First of all, to assess the breathing and the degree of the illness, the NHS symptom checker is useful. There's 3 key questions. Number 1, are you so breathless that you're unable to speak more than a few words? Number 2, are you breathing harder or faster than usual when doing nothing at all? And number 3, are you so ill that you've stopped doing all of your usual daily activities? There are a few ways to assess the level of breathlessness. When speaking to them, assess if they're breathless at rest or unable to complete full sentences. Following this, you can try the sit-stand test, where you ask the patient to go from sitting to standing, up and down, constantly for 1 minute, and then either assess their oxygen saturations if they have the equipment, and if they don't, ask them a question such as, "Tell me what you did yesterday." This will give you an indication of the degree of breathlessness on exertion. A patient who you would describe as verbose following exertion is very reassuring. Don't forget to genuinely observe the patient. Take a moment to look at the patient generally. This may require you to ask the patient to move away from the phone or camera to allow for a wider view. Look for recessions. Ask them to remove their shirt if possible and appropriate. Can you hear a rattling chest, a wheeze or a stridor? And look at how they're sitting. Are they leaning forward or are they avoiding full breaths? It's useful to look at the peripheries of a patient. You may need to explain to them why you need to do this, but don't forget to do it, because you can look at the hands and the feet and this can tell you a lot of information about how the patient is. Try to note if the skin is mottled. Are the hands cold, pale or blue? Are the lips pursed or blue? Are the nostrils flaring? And look at the legs. Is there any swelling? If so, is it unilateral or bilateral? Are the legs cold? You can ask the patient to touch their feet. Is there any blueness in the feet? And finally, is there any redness? And again, is that unilateral or bilateral?